Hi, I'm here with Dr. Christian Verdicchio, the Heart Wellness and Cardiac Rehab Manager for Macquarie Health. How are you today?
I'm good, thank you for having me.
Thank you for joining us. Please tell us about yourself.
Well, my background, I did a PhD in medicine back at the University of Adelaide. My area of focus, I'm an exercise physiologist by trade, but have always been looking at exercise cardiology and exercise interventions and responses in patients with atrial fibrillation or an irregular heart rhythm, and also patients with heart failure. This coincided also with my time teaching at university within the medical school, supervising medical degree students, but also teaching exercise science and physiology as well. So I'm kind of what you say, a clinical researcher, but now overseeing cardiac rehabilitation here in Sydney and Melbourne in our private rehab hospital group.
Well done, that's great. What is heart disease?
Look, heart disease is kind of like a general term. It's an umbrella term that we also call cardiovascular disease, but it's something really that's involved is trying to say something about a disease of the heart. It's like cancer. We call it an umbrella term, and you might have lung cancer, brain cancer, same thing with heart disease. But there are probably four main types of heart disease.
Sure.
One of them is coronary artery disease, which we kind of say is like a plumbing, disorder of the heart, which can lead to heart attack, where there's a buildup of plaque in the coronary arteries. We have arrhythmias, so the most common type is atrial fibrillation, which is an irregular heart rhythm. We have valve disease as well, and we also have heart failure, which was also quite common. So they're probably the most four types common of heart disease.
Very good. So for someone who's had a heart attack, what does the road to recovery look like?
Well, look, having a heart attack these days is, not a bad thing. People do survive and actually live quite fulfilling lives thanks to a whole range of things, treatment, early identification of heart attack signs and symptoms, and also the surgery interventions. People who do have heart attacks most of the time require maybe a stent or an angioplasty or a bypass graft, which is also the case. After these type of procedures, patients would generally trying and start getting involved in lifestyle modification or cardiac rehab, which I'm sure we'll talk about later.
Yes.
But outcomes-wise, those who actually do the right thing and get on top of maybe losing their weight, addressing some risk factors they may have, especially stopping smoking, actually live fulfilling lives better than what they were pre-heart attack. And what we find now is patients who've had heart attacks or have established cardiovascular disease can actually live just as long as someone without.
That's really, really, really wonderful news to hear. So when someone loses consciousness during a cardiac arrest, what damage can that do to one's body?
Yeah, so I think everyone gets confused with this term. So a heart attack or myocardial infarction is what we call a plumbing problem of the heart. It's ultimately a blockage in coronary artery disease, or in our coronary arteries, that lead to a loss of blood and oxygen to a part of the heart muscle. And we get chest pains. Most of the time people are conscious when these type of things happen, and the outcomes are quite good. Cardiac arrest, on the other hand, is at an electrical condition of the heart, so they're completely separate, and it can be quite fatal. It's where ultimately there's electrical signaling with the heart that's so erratic that the heart beats so fast that it actually can't even pump in time, if that makes sense. So ultimately there's no blood being moved out of the heart. And so that's when CPR and a defibrillator is actually key to the patient or the person actually being able to actually survive that incident. And those who obviously are lucky enough to actually have CPR and a defibrillator applied early can live quite fulfilling lives, albeit they may be under constant monitoring and may have like what we call an ICD, like an implanted cardiac defibrillator, like a pacemaker, just in case if it were to happen again.
Yes.
But they can live long and fulfilling lives if obviously the circumstances are caught quite early when these things happen.
Yeah. Could you please tell us about the 3 phases of cardiac rehabilitation programs that you lead within our hospitals and which hospitals they are?
Yeah, sure. So cardiac rehabilitation is ultimately a term where it's a lifestyle intervention, and it's a multidisciplinary intervention. They're offered in public hospitals mainly. We're the largest private hospital provider that give this to patients in Sydney and also in Melbourne. We have 9 sites in Sydney and 1 in Melbourne. So ultimately the 3 phases of cardiac rehabilitation is we call phase 1, so inpatient. This is not as common. The reality is these days people who go to hospital may have procedures relating to their heart. Most of the time are discharged and go home, thanks to obviously advances in technology and recovery these days. But nonetheless, some of the older patients who may need some form of intensive inpatient rehab post-procedure can be transferred to our hospitals, and they'd be seen by a cardiac nurse in our team. But ultimately, most of the patients where they come into our program is phase 2, outpatient cardiac rehab. When they come into our program, they will see an entire team of cardiac allied health specialists. So they'll see a cardiac nurse, an exercise physiologist, a physiotherapist, an occupational therapist, a dietitian, and also a psychologist.
Wow.
So I'm quite proud in terms of what we're able to offer for these patients. Bit similar to, what is semi-offered in the public setting. Obviously, they don't really get a full complement of the team that we're able to offer for our private patients that come through. But also at the same time, our patients actually get a 6-week program where they come 3 times a week. They even have hydrotherapy available after their exercise sessions if they want it. But they get in total 20 sessions. And really, the biggest difference when we look at cardiac rehab in Australia, the average that we see in terms of sessions is around 10. If you take, for an example, a lot of programs are 4 weeks, 2 times a week, or 6 weeks, 2 times a week. There's 8 to 12 sessions there. So we offer 20 sessions, which is fully covered under their private health fund. And so obviously they're getting double the opportunity to really improve their health after they've had these type of procedures or admissions into hospital. And then obviously once they finish that program, we call phase 3, and that's a maintenance program. This isn't really typically offered in programs. The reason being is obviously funding constraints and these type of things. I'm a bit lucky since I took up this role, and obviously my research background in exercise cardiology and long-term exercise interventions, and my CEO was quite happy that we actually take in the costs at no charge to the patient, and we'll follow them up when they leave. We do understand that these type of lifestyle and exercise interventions take time, and so patients need like I sometimes say, a bit of a kick up the backside. So they would leave our program. Our cardiac nurse would give them a phone call every fortnight for about 8 weeks, and then they'd come in 12 weeks after they completed the program, and we redo their assessment again, their exercise assessment, the cardiac nurse assessment, see how they're going in terms of symptoms and things like that. And then we provide them again with more information, see how they're tracking along, and then we let them go for another 6 months. And then we bring them back again and redo those tests. Ultimately, it's really a 12-month program. We have started to see that happen now with our follow-ups, because obviously being here only for a year, and since we revamped the program under my leadership since being in the company, but the feedback's been quite positive, and the reality is we know that we're the only ones that actually provide all 3 phases of traditional cardiac rehabilitation in Sydney and obviously Melbourne.
That's fantastic. You're doing a wonderful job.
Thank you.
Well done. So you mentioned atrial fibrillation before. Could you please expand on that? Yeah,
so atrial fibrillation is an arrhythmia. It's firstly, it's actually the most common arrhythmia, but it's also now the #1 cardiac cause of hospitalizations in Australia. So we typically always talk about heart attack, we talk about heart failure, but my research group back in Adelaide published some data about 5 or 6 years ago now, where we looked at hospitalizations, and we found that over a 20-year period, atrial fibrillation significantly increased by around about 300%. Compared to that of heart attacks and heart failure. So now we know for a fact that atrial fibrillation is the #1 cause of cardiac-related hospitalizations in the country. It's an irregular heart rhythm ultimately caused by erratic electrical signals that originate in the upper chambers of our heart, so the atria, and then we have 2 lower chambers of the heart, which are called the ventricles. And these cause the atria to quiver and obviously beat irregularly. And then it can also cause or be a risk for stroke as well. So we do know that 40% of strokes are actually caused by people who actually have underlying atrial fibrillation. Signs or symptoms of AF can be, palpitations, having a racing heart, shortness of breath, feeling tired and fatigued, dizziness, lightheadedness. Those type of symptoms can be signs and symptoms of atrial fibrillation. And we now know that people who are over the age of 55, 1 in 3 people can actually suffer from the condition as well. So it is a quite prevalent condition, but we also now know through our work back in Adelaide, that's a reversible one as well.
Wow, that's really good. So with surgery, like reversible,
look, we can,
clearing out arteries and things
yeah.
like that?
So we don't, it's not a plumbing, it's an electrical
Yeah,
thing. So
electrical,
there can be, surgeries that may need to be done for patients with AF. Typically, atrial fibrillation works in a few ways. You can have short episodes of an irregular heart rhythm and they can go back to a normal rhythm on their own. Or, those stubborn ones that, obviously you're in that irregular rhythm for some time where you may need medication to help revert it back, or if you actually do need a surgical intervention, they typically might get something called a cardioversion, which is kind of like a defibrillator where they shock your heart back into a normal rhythm, or another procedure, what they call it an ablation. So they would go in and they would look at where some electrical signals are coming from within the heart, which shouldn't be, and you're ultimately burning them or cauterizing them to make sure that that signal doesn't happen anymore, and that the proper signal from where it should originate actually takes place, and so the heart can go back into a normal rhythm. We now know, though, that while surgery is important for patients, risk factor management is ideal. So we know with patients with atrial fibrillation, we call it a lifestyle condition. So you would typically see patients who obviously over 55, or age is a factor, overweight, have hypertension, have sleep apnea, physically inactive, smoking, diabetes. So the real typical lifestyle risk factors. And we know that if we actually get patients to lose weight, we get patients to really try and get on top of their hypertension, whether it's through medication, also improving their exercise levels, taking therapies for their sleep apnea, so having a CPAP machine when they go to sleep at night, cutting down on their alcohol intake. And we actually found that the heart reverses back to a normal type of modeling, if that makes sense. So the heart starts to remodel itself back into a normal type of
rhythm as well.
It does.
Exactly.
So, and ultimately we now see that people have less atrial fibrillation, or actually can have no atrial fibrillation at all. And so it really is a lifestyle condition, and very important message that we still continue to promote how atrial fibrillation would typically progress from short episodes to longer episodes. We now know that through weight loss and exercise and these type of lifestyle interventions, you can actually go away from not having AF without surgery, or if you still need the surgery, you're more likely not to have a repeat procedure. So it's a win-win either way.
Wow, it's nice to know that if this does happen to someone, there are ways to reverse it, but we don't want that happening in the first place.
No.
So do you have any good tips on how to prevent heart disease and things like this? So
yeah, look, it's the same old story, really. Weight is a very big one. Our bodies are not designed to be overweight, especially because where we store fats, around our vital organs, adipose tissue or fatty tissue can be very, what we say, inflammatory, and it can cause a whole range of nasty things and changes to the heart, from its structure to its function, and it can lead to things, such as heart attacks, such as atrial fibrillation and heart failure in the long term. But also at the same time, being physically active, is a very important one. Since moving to Sydney, you probably spend a bit more time in the car as well when you're driving, commuting.
Right.
And when you think about it, our bodies also, if you look about 2,000 years ago, our bodies weren't designed to sit down. We were designed to move, be physically active. Now, we sleep 8-9 hours a day. We go home from work, we sit down at the table to eat dinner. We sit down in the lounge to chill out afterwards. We sit down at work. We sit down in the car. We are very sedentary these days. And so those 30 minutes a day that they recommend of physical activity and exercise is actually key. But also the other one, I would definitely say smoking. Smoking does make a massive difference, and does change the heart and the coronary arteries in a way that, is not normal. And so if there was any tips, it would definitely be obviously healthy weights, exercise, and no smoking.
Great tips there. Well done. So what sort of things do you personally do, for exercise and things like that? What do you do to keep your heart healthy?
Well, I do keep fit.
Yeah.
I obviously, with a sport that I do referee football or soccer. So a lot of the things I do is mainly running type of training, interval-based type of training as well, which is obviously very important and has massive benefits in people who have heart disease as well. And also I do a bit of strength training as well, but I do about 4-5 sessions a week. I do find that, after a period of time, I can understand that people can become lazy and complacent with their time and just want to relax after work. But, once you do get in the rhythm of actually exercising and being physically active, you do notice a difference with your general health and well-being.
Yeah.
And I know we have a family history of heart disease, so obviously wanting to stay away from that, try and be as healthy as possible.
Well done, yeah.
And so I think it's very important to, try and promote and do what you're promoting, I guess. We see a lot of people who say you should exercise and stop smoking, and then sometimes they step outside for that few minutes and have a smoke while they're outside and their patient walks out. So I think it's very important to set a good example.
Yeah, that's true. That definitely. So you're saying that's like hereditary or things are running in your family. What inspired you to get into this field of medicine? What was that a reason?
No, it actually wasn't.
Mm-hmm.
I became an exercise physiologist when I was at uni, obviously studying, and then I felt maybe to do an honours degree because I thought it would give me an edge when it came to employment or future career paths. So I enjoyed cardiovascular disease or cardiology, so I found an honours topic in exercise assessments in patients with heart disease at Queen Elizabeth Hospital back in Adelaide.
Yeah.
Whilst I was on my honours, I was teaching at uni, and I thoroughly enjoyed teaching. So then I realised when I finished my honours, the only way to get a full-time lecture position was to do a PhD.
Beautiful, yeah.
So I went across to University of Adelaide in the medical school, and I came across Professor Prash Sanders and Dr. Adrian Elliott, who are leaders in the field in atrial fibrillation in the world and exercise and AF. And I didn't know who they were, but I realised very quickly who they were once I started.
Yeah.
And then, it just kind of spiraled from there, really. I fell in love with the ability to research in this cohort, make an impact, present my work abroad, publish in the area, but also still teach at the same time. And I guess now, I'm still, involved in that to a degree, but also at the same time overseeing a heart wellness and cardiac rehab program, across multiple sites. So I do think I get the best of both worlds, really, from a clinical research side of thing and from a practical aspect as well.
Definitely, that's fantastic. Great work.
Thank
so,
you.
In regards to the being a rehab manager, what are you overseeing? What's the kind of rehabilitation that people are actually doing within
in our program?
Yes.
So within our heart wellness program, most of the patients, like I said, do come in an outpatient setting. So they'll come in, they'll see our cardiac nurse.
Mm-hmm.
The cardiac nurse would, go through an assessment with them just to make sure nothing's changed since probably the last time they saw their GP or the cardiologist. So that's always important, especially those who are post procedures. We want to make sure that everything's still okay and good for them to exercise, because ultimately that's what it is. It's an exercise intervention program. Yeah. We'll do some questionnaires as some baseline measures. They'll go over to see an exercise physiologist. They'll do our physio. They'll do their exercise assessment, so we can actually objectively quantify where they're at in terms of their exercise capacity levels. And then we set their 3 times per week program. And the main aspect to the program is an exercise intervention. Cardiac rehabilitation has got this stigma where it's quite conservative. It doesn't have to be. It can be not aggressive, but we can actually push the patients quite well. They've done their procedure, they've had their events, they're well managed and stable. So, what we say is aerobic interval training is a very, very good, safe and effective type of training in this patient. So, we would look at, mixing it up. So some patients who have a good baseline level of fitness, getting them on the treadmill, on the bike, working hard for that 4 minutes, as you probably know, have a couple minute break and doing that 4 times.
Yeah.
Others may be just like a continuous cycle or walk to build up to, say, 20 or 30 minute aerobic duration of exercise, but we do tailor it to the individual. But one of the most important parts about the program, what I've been able to push and talk and I guess educate my staff is really about that we can actually push these patients and really get some good significant benefits, make them feel comfortable. Because the last thing you want to do is actually try and be very conservative with them, make them a bit more apprehensive with doing things when they go home as well, and just kind of add to the whole thing that they need to relax. In actual fact, they can actually push themselves, which is a good thing. So, that's the base of the program. They see our dietitian every couple of weeks to provide them with that dietary input. If we identify signs of, say, high anxiety, or depression, they would be screened and would be seen by a psychologist in the program, and also at the same time they would be seen by OT and physio during the program as well, and they obviously have access to hydrotherapy and some other types of equipment that we have available that is really important, that can actually improve their just overall well-being that we have on offer at the hospitals.
Well done. Okay, I really think that you guys are doing an amazing job with
you.
the rehabilitation program and everything you do to help keep Australia healthy. Thank you so much for joining us today. Is there anything else you'd like to add?
Look, I mean, thank you for having me here. I guess, you know, if people want to know more about our heart wellness program, they can go onto our website at www.heartwellness.com.au. We have 9 sites in Sydney and another one in Melbourne, and they can request a call back, and we can contact them and to discuss how they can be eligible to come in under their private health insurance, which is completely covered, and we'll be happy to try and get them on top of their heart health.
Wonderful. Thank you. It's lovely to meet you.
Pleasure. Thank you for having me here.
Thanks.